are so thrilled to have Sarah Kivett with us today. Sarah has been an oncology nurse for over 20 years, and with that has gained a bucket load of wisdom and knowledge about navigating a cancer journey. But more important than all that, Sarah brings a warmth and sensitivity that all of us need, whether in a cancer journey or not. Please welcome my friend, Miss Sarah Kivett.
Okay, as Karen said, I have been an oncology nurse a long time, and a little bit with that story is that when I got out of nursing school and I applied for a job, they wanted to know what area do you want to work in, and I said anything but oncology. Okay, and within a year and a half, I was working full-time in an oncology office, and I haven't really done anything else until I came here. So it really is a passion of mine. I truly believe in the work and the time that we spend in this cancer journey, and I think it's very important. So let's look at what plans are and why we need a plan to start with. Some of you may be planners, some of you may not be planners. I kind of am a little bit, not a little bit, but it's very important because this is a journey. It is very much a journey. Those of you who are survivors, you understand that what is happening this week may be a little bit different than what happens next week, or how this treatment goes may be not the same as your next treatment in your next cycle and how that goes. So as we look into that journey, it's really important that the main person and the consistent person that's in your journey is you. You may have a different doctor, you may have a different nurse, you may have a surgeon, you may have a radiation oncologist, you may have a primary care physician, but the one who's always there at every one of those appointments is you. And that's why it's very important that you understand what your treatment is, what the plan is, and to write that down. The other thing, if you're anything like me, you can have questions in your mind before you go somewhere, and then you get there and you forget what that question was and what you were going to ask. Writing things down and in a plan can help you to remember, have I got everything covered? Do I truly understand what's happening to me? Because one of the most unsettling feelings that I've heard from people is to think that it's going to happen one way, and then you get there and you're getting something different that you didn't expect to have.
Which tool do you use to create a survivorship plan?
American Society of Clinical Oncologists. And that is where your oncologist goes for the standard of care that for all cancer treatment. They're kind of like the gurus. If your oncologist is going to a big national meeting to understand new guidelines, it's probably an ASCO conference. Okay, so these are national guidelines that your oncologist is going to be familiar with. Are they always going to remember? No, but they are familiar with the word ASCO.
Steps to build a cancer survivorship care plan. Step number 1, you complete everything you can on the treatment summary and survivorship care plan form. The form is located in the appendix of the Bible study.
All right, so the treatment plan summary is, you can go on that website or you can go to the appendix. We can print that off, and you have a copy of that in front of you. And it's a guide to what is going to be happening to me. What is the plan for my treatment? Do I have, what's my tumor size? And why is that important? Because that helps with staging. You've heard about staging. You've heard about what different stages, and that's important because that helps them to decide what kind of treatment you're going to have. Because if it's stage 1 versus stage 4, those kind of things. So it's very important to have that in your plan as well. So using the treatment plan, your current oncology will enter your chemotherapy dose. Now, does it have to be your oncologist that does this? Who really knows more about what doses you are getting? It's your oncology nurse and the one that's actually giving you the treatment, right? So if you're not real comfortable, or if your oncologist isn't someone that sits down with papers, your nurse likes this kind of stuff. I promise you. I have been a chemotherapy nurse. They like to help you keep organized. They like to have informed patients. So it's okay to have that nurse to help you fill this out and to help you to know what is happening with you at the treatment at that time. The number of cycles, your specific drugs, all of those things. And when you have that treatment plan, and you have written down if you're going to have surgery or not, if you're going to have radiation and how many radiation doses you're having, that helps you then as we move on into a survivorship care plan. Now, that brings us to the point of what is the definition of a survivor. A cancer survivor is anyone who's been diagnosed with cancer and still living. Okay, you are a survivor from the day one. You are surviving it. Even if you've not even started treatment yet, you have survived hearing that diagnosis, and you are living, you are surviving. So remember that. So as we go through your journey, and you know what your plan is, you know what your treatment, and you're getting your treatment, then we look at, well, what happens afterwards? Because we're still, even though you're dealing with side effects maybe while you're getting your treatment, sometimes some of these drugs have long-term side effects. And then when you're not seeing your oncologist anymore and you're seeing your primary care physician, if you have a treatment survivorship care plan, it's going to help that primary care physician to know what to look for if you come in and have problems. And to know that, you know what, you have been treated with, as a breast cancer survivor, and you had large doses of adriamycin. And one of the things with adriamycin, you can have long-term side effects with your heart. So we need to make sure that if you're having some heart dysrhythmias or something, that's an important part of information for them to know that this is can be a long-term side effect of that medication that you got. So that can help them to know exactly how to treat that. And if they send you to a cardiologist, he definitely needs to know that you had that medication. So instead of trying to remember to tell them that you've had that medication, you have a care plan and you have a treatment summary. And then all you have to do is to take that with you and make sure that your cardiologist, if you have one, has a copy of that. Your primary care physician has a copy of that. There are times when you go to a gastroenterologist, a dentist. Everyone needs to understand this history, especially if you've had a cancer that may be related to head and neck, anything like that, and you go to a dentist. They need to know what your history is and what your summary is. It's a very important thing, isn't it? A very important thing for them to have. So what do the survivorship care plans, what do they include? They include your medical history, which is very important. They include specific information that's related to your diagnosis as well as your treatment. Information about possible late side effects and signs of recurrence of new cancers. So one of the most stressful things is, okay, you go and you have repeat scans in 3 months, you have repeat scans in 6 months, you have repeat scans in a year. And when that anniversary date of that comes up, do you get a little anxious? You get, you have that little bit of something in the back of your mind, and you want to get those results, but then you're a little bit anxious about that. Or you go to your primary care physician and you're thinking, it's been 6 months, I probably need to have a scan, and he's not ordered one. Well, maybe he forgot. Maybe he forgot, not meaning to, but that's, not something he's thinking about. Your survivorship care plan can have recommendations on it of when you should have your follow-up scans, how you need to stay healthy and to be able to know that, I am 3 years out, that now the recommendation is I don't have to have that scan but every other year, for example. But I don't need to go 5 years without it. Every other year is good. That's the national standard. That's what I need to be doing. And that care plan can help that physician and you stay on track for those things. That can help decrease that stress to think, should I be having scans? Should I not be having scans? But the ASCO website has recommendations about those things. Your oncologist understands the recommendations about those things, and that nurse understands those recommendations, or at least has access to know what those need to be, and you can fill that out. Then you don't have to, do I remember? What did they say? I don't know. Oh, I have it written down. And that's extremely important, not just for your peace of mind, but for your journey in staying well after you've gone through all the treatments, and being able to be confident in taking control of your journey, and not just out there wondering if what is happening and what should I be doing about it. The other parts of that has to do with making sure that if you do have questions and you're not really sure what kind of diet you should be on, if you have questions about is it okay for me to exercise? Is it okay for me to have sex? Is it okay for me now to go 6 months or a year without seeing my physician? Is it okay to do that? Write those questions down and have those answers on that care plan, because that part of the care plan is very important as well, because it helps you to answer questions that you want to make sure you're doing the right thing for yourself. It may not be so much related to a direct drug and what kind of drug you've had and the side effects of that, but it's a very important part of your body, and to getting back to living, living your day-to-day life, taking, thinking about things, going on vacation and doing all of those things that you've wanted to do but you've had to put on hold. Is it okay for me to get back and to start doing those things now? I hate to say, but doctors take those things for granted. They think that, okay, your treatments, you're doing good, and so they just, you're doing good, so you're doing good. That answers all your questions. Well, no, it doesn't. Does doing good mean I can get out in the sun again? Because some of those drugs, while I was taking them, they didn't want me in the sun. Is doing good mean that I can get back out in the sun again? So doctors sometimes talk in general terms, which is okay, but there may be specific things that are nagging at you that you're not too sure about, and it's okay to ask those things and to write those down. Or if you know that you don't need to be back out in the sun for a while, make sure that that's written down, because then there may be other medications that your PCP may say, oh, you're not supposed to be in the sun. Well, then I don't want to order this for you, kind of thing, or we need to stay away from this. But that's why we share this information. So you're in the doctor's office, and what are they doing? They're over there and they're typing so many things, and all of this information gets put in your electronic medical record. So why do I need this if there's an electronic medical record, and we're hearing about all of these things about how you have an electronic medical record so all your information can be shared between all of your providers, and that, everybody has access to that information? Well, in theory, that is a very good thought. In reality, they don't always read them. Okay? And if we print those off and carry those out around, I literally, the electronic medical record, when you print it off, creates a lot more paper than just a regular paper chart. And this came to reality to me when I was still working in the hospital, and we printed off a record of someone who had been in the hospital less than a week, and it was 600 pages. So if you look at that, that's not something you're going to carry around. And if you give that to your physician and say, this is my medical record, they're not going to read it. I'm just going to tell you. They're not going to skim through and read that many pages. Whereas with that form that you have in front of you, is it very deep? Is there a lot of it? It's 2 pages, right? It's 2 pages. They're going to be more apt to sit down and read the summaries because that's going to give them a gist of what they need. And they may need to ask a few more questions, or if they're not really sure, then they can go to that medical record, but then they'll know how to go exactly where to look to find that particular thing and not going through all of that. Does that make sense? So I think that it's going to, for lack of a better term, get to the point a little bit faster for them, and physicians like that, you know, that they want to get to the point and what's the problem and what brought you here today, and to really understand and to be able to make good decisions, because they do want to make good decisions for your care and what's happening with you. And again, as we talked about earlier, you're the only one that has been there at every one of those appointments. You know, you are the one that drives the bus with that because you have been there at every single appointment. You know, you may have a different oncology nurse because this one's covering for this one, so they're not going to be at every treatment, but you've been there at every treatment and you know how every treatment has gone. So you're the one that needs to make sure that the information's right and that they can make good decisions about that. I'm going to pause just a minute and see if you have questions.
What if my oncologist is from a large cancer center?
There are a lot of, now in local areas like here, some of the oncologists you continue to see for a very long time. There are other places where if you're in a big cancer center and you're finished with treatment, then they release you back to your primary care physician in your hometown. And that's where it's really important to make sure that it's filled out so you can take that back to your physician that hasn't been involved in those treatments where you've been in that large treatment center. Other questions? I think we'll turn it over to Karen. All right.